I know I was following the FDA guidelines as like in drug therapies and how they approve drug therapies for a while. There was a documentary on the Berzinski Clinic down in Texas. Did you ever hear about this?
I think I did actually.
So they were like kind of making their own like cancer like medication in-house, right? And and so they started curing a bunch of different cancers that were typically uncurable, especially in children, right? And so, but the FDA came in, and even like the FBI came in, and they were like rating him a bunch, and like he had been to court a bunch, but it's because he wouldn't complete FDA trials. And part of that was because in order to pass an FDA trial, you have to subject your patients to your therapy and then the standard treatment of care, right? And how it meshes. And he didn't want to put his patients on chemotherapy. So he's like, chemotherapy is really harmful. I'm not subjecting my patients to that just to pass an FDA thing.
Right, he took an oath and took it serious.
Yeah. And so that's what he said. I was like, I took an oath not to harm my patients. He's like, there's just no way you're pushing chemotherapy on patients and not, saying that this is not an issue, right?
Yeah.
So he didn't want to do that. And of course, the FDA didn't like it. And of course, the whole pharmaceutical world, selling $25,000 chemo bags didn't like it either.
Oh, big time.
And like he had this massive like multiple raids, all this stuff. That the documentary is like, it just makes you just pissed.
Well, how many cases are like that just never got
televised?
Out
a lot.
I mean, I don't even want to know how many people that got screwed on that.
Yeah,
that had good intentions. Yeah, and I think ultimately, it's sad that it takes we have a government body that like puts the squeeze on people, and using law enforcement on top of that is just shameful.
Yeah,
honestly.
Yeah. No.